Good morning and best wishes to all of us. Dear judges of Sustainable Development Goals 2026. According to World Health Organization data, around half of the world's population is now at risk of dengue fever with an estimate 100 to 400 million infections occurring each year. The highest number of dengue fever cases was recorded in 2023, affecting more than 80 countries in all World Health Organization regions. The Americas, Southeast Asia, and the Western Pacific are the worst affected, with Asia representing around 70% of the global disease burden. A large number of cases were reported in Asia, Bangladesh, Malaysia, Thailand, and Vietnam. Based on this problem, I am Agnesa Maratushadia from Amik Taruna proposed the solution through DFAG, Dengue Fever Application Card, namely features that include early notification of dengue outbreaks based on data collected from various health sources. The app also provides easy-to-understand educational information about symptoms, preventive measures, and action to take it infected. Through integration with the local health system, DFAG, Dengue Fever Application Card is able to provide up to update and valid information to users and help coordinate between the community, health workers, and the government in dealing with the outbreak. This product innovation focuses on several ongoing SDGs-related agenda, specifically aiming to address the following: SDG 3, good health and well-being, serving as the primary goal by improving treatment adherence, providing health education, monitoring patient condition, and preventing TB transmission. SDG 9, industry, innovation, and infrastructure, through the introduction of digital innovation in the form of a health application that supports the technology-driven transformation and a healthcare service. SDG 10, reduce inequalities, as the application provides easier access to information, consultation, and health monitoring for the entire population, including in areas with limited service availability. SDG 17, partnership for the goals, through the integration of patients, healthcare workers, hospitals, community health centers, and the government in a collaborative effort to control TB. User can access DFAG with various features available. The following is an explanation regarding the innovation of the menu icon in the DFAG. First, the profile menu aims to provide information on users or patients infected with dengue fever, including the status of the patient's health condition. 2. Menu Come on Check Your Health. Menu contains information about dengue fever such as symptoms, cases, and how to treat dengue fever. 3. The local and surrounding TB infographics. Menu views and controls the movement or distribution of dengue fever in the local environment and around the patient residence. This menu can only display the location of people infected with dengue fever. 4. In the nearest hospital. Menu patient can see the nearest health service, which allow patient to be referred for treatment later if needed. 5. Emergency call menu, if you need emergency help to treat dengue fever. 6. The set reminder menu is to set a schedule for when the patient is to take medication. 7. The examination history menu show the patient examination history and the schedule for examination to be carried out. 8. The daily self-diagnosis menu was created with the aim of providing information about the patient's feelings of illness and condition by diagnosing the disease independently, and this can be monitored by a doctor or the nearest service center. 9. The types of food menu was created with the aim of providing education to patients so that they can choose and shop foods that can be consumed for the healing process. Apart from that, the doctor will provide a menu of what foods are permitted and prohibited by the sufferer. This menu can also be interacted with so that the patient can communicate with the doctor regarding all the food menu that is being eaten. 10. The AI menu that includes epidemic monitoring. AI monitors and tracks the spread of dengue fever in real time, displaying a distribution map with details of location and severity levels. Notification and early warning. User will receive notification if there is an increased risk of dengue fever in their area. This warning can take the form of preventive action citation. Vaccination and treatment information. AI provides the latest information on vaccination, treatment, and health protocols recommended by health authorities. AI chatbot. An AI-powered chatbot can answer user questions related to dengue fever, app features, and initial medical advice. This chatbot is designed to provide quick and accurate response even outside of working hours. 11. Menu application setting. Menu to set several features which can be adjusted manually to suit the patient's need. 12. The home. Menu is created with the aim of displaying the main menu of the DFAG application if the patient is currently operating in the existing icon menu. 13. In the chat menu, user can ask for relevant information from the health service center. And this is the workflow of DFAG. What is the work procedure flow for using the DFAG? First, see people-like symptoms of dengue fever, check with the general practitioner, lab test to check the patient disease. All DFAG features and accounts are integrated with dengue fever sufferers. Dengue fever patient create a DFAG account by those on duty at the hospital. The patient is positive for dengue fever. The patient carries out two-way self-healing with the doctor and is monitored by the hospital. The stakeholder involved is first community. For users or patients, use the application to receive early warnings, health information, and report dengue-related condition. 2. Healthcare workers. Monitor patient conditions, provide medical guidance, and respond to report cases. 3. Hospital and healthcare facilities. Deliver treatment and receive patient referrals through the application. 4. Local health authorities or health department. Monitor dengue outbreaks, analyze data, and coordinate prevention and control programs. 5. Government. Utilize application data to support public health policies and decision-making. 6. Application operators or administrators. Manage the system, maintain data accuracy, and ensure the application operates effectively. The difference before and after the introduction of this innovation. Before, information, monitoring, and management of dengue fever were handled separately, resulting in a slow response to cases. After, DFAG integrated monitoring, early warning, education, reporting, and healthcare service coordination into a single application, making case management faster and more effective. The advantage of using the DFAG application: first, improve monitoring and early detection. 2. Education and information. 3. Effective information dissemination. 4. Enables better coordination between various related parties, such as health service, hospitals, and the community in efforts to control dengue fever. 5. Easy case reporting. 6. The application can provide information about post-recovery care, monitor the condition of patients who have recovered, and provide guidance to speed up recovery. 7. More efficient use of resources. That's all from us. Thank you.